In this video at Medical Sciences, we want to discuss today about sympathomimetics, or what we can call adrenergic agonists. We have seen different functions of sympathetic nervous system. So we want to see if the noradrenaline is not functioning well, or the receptors are not responding to it, or epinephrine. Which drugs can we give to enhance the action? So we're going to see different drugs that act, or we are going to classify them, whereby we are going to have direct acting, indirect acting, and mixed action. What do we mean by direct acting? Direct acting, this one means these ones bind directly to receptors. They bind to adrenoceptors. Whereas indirect acting, for them, they act by either increasing release, they increase release of norepinephrine, or they act by decreasing or inhibiting reuptake. They inhibit reuptake. So those are the indirect acting. Either they enhance the release of norepinephrine, or they inhibit the transporter for the reuptake of norepinephrine. Whereas mixed action, meaning these ones, they act on both alpha and beta. They act both on alpha receptors and beta receptors, so they don't segregate. So that's what we are calling mixed action. And under direct acting, those which bind directly to alpha and beta receptors, we have those that are catecholamines with a benzene ring, and those which are non-catecholamines. And under catecholamines, we are going to discuss about epinephrine, or which we can call adrenaline. We are going to discuss norepinephrine, then dopamine, then dobutamine, and isopretanol. These are the, and among the catecholamines, we have the first three are endogenous, whereas the last two, they are exogenous catecholamines, meaning these ones are synthesized, whereas these first three are found in the body. And this epinephrine is currently used in treatment of anaphylactic reaction, anaphylactic reactions, or people with hypersensitivity reactions type 1, or allergic reactions. They are being used also in relieving intraocular pressure, when they are going to do surgery, so that because it is midriatic, by acting on alpha 2, on alpha 1 and beta 2 receptors. But majorly this intraocular pressure is produced by binding of beta 2 receptors within the ciliary muscles of the eye. So it can cause mydriasis, so that someone can do surgery. Then this is anaphylactic reactions. For example, someone with allergic rhinitis can be treated with epinephrine. And then lastly, this one is majorly being applied with local anesthetics, for example, lignocaine or lidocaine, so that it causes, because it is targeting alpha 1 receptors, which causes vasoconstriction of the vessels at the surgical area, especially done by dentists and anesthetics. And when it is applied in these local anesthetics, the adjuvant in local anesthetics, its major role is to block or to cause vasoconstriction of blood vessels. And when they constrict, meaning the area is not much producing blood, or it is decreasing blood flow to the surgical area. And another one, it is prolonging the action of the local anesthetic, so that it does not cause toxicity in the systemic saturation. So it localizes it. It makes the local anesthetic, like lidocaine, to remain at the site where it has been put, by causing vasoconstriction. So this is the major applications of epinephrine, which is always produced from norepinephrine by addition of a methyl group. And we know that epinephrine and norepinephrine, they are also produced within adrenal medulla. Then another drug we can talk about is norepinephrine, or you can call it noradrenaline. This one is being used in treatment of asthma, or because it brings about bronchospasms. So we can apply this norepinephrine in bronchospasms, or some people with asthma, so that it can, because it is a bronchodilator, by acting on beta-2 receptors within the bronchus. And another thing we can apply this is in anaphylaxis. Anaphylactic reactions, those are allergic type or hypersensitivity type 1 reaction. And we can also apply this norepinephrine in septic shock, people with septic shock. This is norepinephrine. This is where we can medically or therapeutically apply them. Then another catecholamine is dopamine. This one normally binds via dopamine 1 and dopamine 2 receptors within the autonomic nervous system. And dopamine is used in treatment of cardiogenic shock. This one we apply it in treatment of cardiogenic shock. Cardiogenic shock. We can apply it there. And another thing, application of dopamine is in the treatment of hypertension. We can use it in the treatment of hypertension. Hypotension. Not hypertension, but hypotension. In heart failure, incidences of heart failure, we can apply this. So cardiogenic shock, people with hypotension, that is decrease in blood pressure, and people with heart failure, we can apply dopamine. The same thing with the dobutamine, which is applied also both in cardiogenic and septic shock. Also in treatment of hypotension. Treatment of hypotension, we normally apply dobutamine. Then the azopretanol, this one is also, we said it is an endogenous, it is an exogenous catecholamine, and it is non-selective. This one, it acts on both alpha and beta receptors, whereas dobutamine is alpha 1 selective. This one, dobutamine is beta 1 selective, meaning it acts on the beta 1 receptors within the heart, increasing the contractility, hence increasing the heart rate and the cardiac output. And that's why we are using it in treatment of hypotension, heart failure, due to its action on the cardiac muscles by stimulating contractions, which was the same as also dopamine. But we are seeing isopretanol, or what we can call isoprenaline. This one is non-selective. It acts on both beta and alpha receptors. So if it acts on beta 1 receptors in the heart, it causes contraction, causing what we call increase in systolic pressure. It causes slight decrease in systolic pressure. At the same time, it acts on alpha 1 receptors in the blood vessels, causing vasoconstriction. Meaning it decreases diastolic pressure. And at the long run, it is nothing of therapeutic use because of lack of selectivity, because when it acts on the beta 1, it is causing contractility, acting on the alpha 1, causing vasoconstriction, causing actually it is vasodilation, causing vasodilation, and when it causes vasodilation, it leads to decrease in the peripheral resistance. So it cannot be used in the treatment of hypertension due to those dynamics, so it is of less therapeutic use. So this is what we can discuss under catecholamines, both endogenous and exogenous catecholamines. Then now we can go to the non-catecholamines, and among the non-catecholamines, we are going to see those which are selective for alpha 1, selective for alpha 2, and selective for beta 2. For beta 1 has been covered under dobutamine, which is beta 1 selective agonist. So don't forget that dobutamine is beta 1 selective agonist. And among the catecholamine, those which target alpha 1 receptors, and these ones are alpha selective, we are seeing one of them is phenylephrine. And this phenylephrine, we know that reactions or functions of neurotransmitters targeting alpha 1 receptors causes constriction or causes stimulation where they are found in the smooth muscles. So when someone is given phenylephrine, if it is in the bronchus, it causes bronchodilation. So it is being used as nasal decongestant. It's being used as a nasal decongestant, as it has a bronchodilation property. At the same time, this phenylephrine, we can also apply it in people with meiosis because it has mydriatic property. So we can use it in the treatment of meiosis. And this one, it is different from atropine, which causes psychoplegia. This one does not cause psychoplegia. So among the drugs which are used to treat meiosis, whereby the pupil has narrowed, so if you want to widen the pupil, we can use this phenylephrine, and it is good because it does not cause psychoplegia, which is paralysis of the suspensory ligaments or ciliary muscles, leading to loss of accommodation. So this one does not cause psychoplegia. So we are seeing this one, phenylephrine, it does not cause psychoplegia, which is paralysis of the ciliary muscles leading to lack of accommodation of the eye. Then methoxamine and midodrine. Methoxamine and midodrine. Before I talk about midodrine, nafazoline and oxymetazoline, these are good nasal decongestants, also nasal decongestants in the case of common cold, in the case of any pulmonary obstruction condition, we can use nafazoline and oxymetazoline. Whereas methoxamine and midodrine, this one we can apply it in the treatment of orthostatic hypertension. We can apply it in the treatment of orthostatic hypotension, because we know that this one will act on the blood vessels, causing increase in the blood vessel resistance. Hence, we can use it in treatment of orthostatic hypotension, which is always a side effect on people with plazocin and terazosin. So we can use methoxamine and midodrine, which is an alpha 1 selective agonist, to treat orthostatic hypotension. Then nafazoline and oxymetazoline, which are also alpha 1 selective, but sometimes they also act on alpha 2, but majorly they are for alpha 1 for nasal decongestants because they have bronchodilation property. Then after finishing alpha 1, we are now going to look at those ones which act on alpha 2 receptors. And we know that alpha 2 receptors is found in the presynaptic, and its major role is to prevent or to inhibit production of norepinephrine. So it is inhibitory. So we're going to see these drugs causing inhibitory effect when applied. For example, clonidine, methyl-dopa, guanafacin, and guanabens. These ones, they can be used in treatment of recurrent migraine. You can use it in treatment of migraine. Those are constant headache. You can use them in treatment of hypertension. Treatment of hypertension, because we are seeing these ones are inhibitory. Whenever they act on these receptors, they cause inhibition of production of norepinephrine. So they are inhibiting the roles of sympathetic stimulation. These ones can also be used in withdrawals to trigger people with withdrawal syndromes. Like those ones who have failed to leave alcohol, we can always apply clonidine, methyl-dopa, guanafacin to enable them to withdraw from alcohol, because it is going to act by depressing the action of sympathetic system, or that is the production of norepinephrine. So this is some of the applications of clonidine and methyl-dopa together with guanafacin and guanabens. They are also products of this. Then tizanidine for it is being used for tizanidine. It is used as a muscle relaxant. This one is used as a muscle relaxant. Being used as a muscle relaxant. Whereas this clonidine and brimonidine and apraclonidine, they are also used as decongestants. Remember, they are acting on the alpha 2 receptors, and when they are inhibiting, they are going to cause what we call inhibition of secretions. And for example, in people with glaucoma, whereby there is increase in intraocular pressure due to accumulation of the aqueous humor, so we can apply this inhibitory effect of alpha 2 to inhibit secretion or production of aqueous humor, so that we can apply them in treatment of glaucoma. And apply them in treatment of glaucoma. Then these are the conditions of alpha 2. Remember that alpha 2 is inhibitor. It is GI, so its reactions are opposite of these others. Then we have also beta 2 selective agonist, and among the beta 2 selective agonists, we shall see salbutamol, terbutarin, salmeterol, and so these three, the first three, salbutamol, terbutarin, salmeterol, formoterol, all of these ones are used in the treatment of asthma. Those ones with asthmatic attacks, treatment of asthma, and other chronic obstructive pulmonary diseases. Any chronic obstructive pulmonary disease and also asthma, we see them targeting beta 2 receptors in the bronchus, causing bronchodilation or widening in the lumen of the bronchus, hence opening the airway. So salbutamol, and in the previous video we saw also cholinergic blockers, where we saw ipratropium also being used. Sometimes they are used in combination with ipratropium to work well by treating asthmatic patients. Then ritodrine for it targets the beta 2 in the uterus, and it causes relaxation of the uterus. It causes the uterus to relax. So whenever someone has threatened abortions, maybe there is increase in the contractions of the uterus in pregnancy, we can always apply ritodrine. And this ritodrine, it will help us to relax the uterus. And even people with dysmenorrhea, you find every time you go to menses there is much pain, we can always apply ritodrine to treat that pain during menses. So this is the application of ritodrine. But these first three, it is for asthma and chronic obstructive pulmonary disease, whereas the ritodrine is for uterus relaxation. So this one is about the non-catecholamine. Then last one among non-catecholamine is that one which is beta-3 selective, and the beta-3 selective is majorly found in the adipose, the beta-3 in adipose and the bladder. So we are using a drug which is a beta-3 agonist, that is mirabegron, and this mirabegron is used in treatment of overactive bladder. Overactive, find someone's bladder is overactive, there is continuous or frequent urination or urinary incontinence, we can apply mirabegron, which targets the beta-3 receptors within the detrusor muscles, leading to relaxation of the detrusor muscles, hence treating the overactivity of the blood, of the urinary blood. So this is the beta-2, a beta-3 selective agonist, mirabegron, and is the only one we have as an example. After seeing this, now we go to indirect acting, which at the introductory part we say they are either inhibiting release of norepinephrine or they are inhibiting reuptake. And among the indirect acting, we have amphetamine, and modafinil, and this amphetamine being for it acts by inhibiting, by increasing the release of norepinephrine. So for them, they increase the release of norepinephrine so that it can act. And these ones play a big role. First of all, they play a big role in treatment of, there is what we call children who lack what we call, they are deficiency of, they are suffering from what you call attention hyperactivity deficiency, or they don't settle for one thing, what we call attention deficit hyperactivity disorder. So you can use amphetamine and modafinil to treat this disorder, which is people, and there are people also who may be long distance truck drivers, or maybe people with narcolepsy, like modafinil is good for narcolepsy, whereby narcolepsy is excessive sleep, day sleeping, even when you're moving, you are falling asleep. So abnormal sleeping during the day, whereby someone who cannot concentrate, we can give them modafinil, which can treat this narcolepsy. So these are some of the indications of amphetamine. And then there is this which is called tyramine. For it inhibits MAO. It inhibits monoamine oxidase. And this monoamine oxidase, we saw it was responsible for degradation and excretion of norepinephrine. So this one acts by inhibiting MAO. So when it inhibits MAO, meaning it will also lead to the accumulation of norepinephrine, hence bringing about attention or increasing the activity of the sympathetic system. And these ones we can also use them in treatment of hypotension, treatment of low blood pressure, that is hypotension. Then we have these ones, they are increasing release. This one is inhibiting degradation, that is tyramine. Then the tricyclic, what we call TCAs, like cocaine, imipramine, and amitriptyline, these ones, they act by inhibiting a reuptake. These ones, they inhibit reuptake through the norepinephrine reuptake transporters. So when we inhibit reuptake of norepinephrine, it means it accumulates in the synaptic cleft, meaning it increases the activity of that place. And this cocaine, they are used in treatment of depression. People with depression, we can apply them, treating people with depression and anxiety. People who are having anxiety and depression, we can always use cocaine, imipramine, and amitriptyline in treatment of depression and anxiety. Then the last one is under indirect acting. We have SNRIs, which we call serotonin norepinephrine reuptake inhibitors, which we have these two, and they are being applied in treatment of still depression. We can apply them in treatment of depression. We can also apply them in treatment of diabetic neuropathy, diabetic peripheral neuropathy, so that we can activate the transmission of impulses within the extremities. So these serotonin norepinephrine reuptake inhibitors like duloxetine and atomoxetine, they are being used also in depression treatment, then treatment of anxiety still, and diabetic peripheral neuropathy. So these are the indications of duloxetine and atomoxetine, which are serotonin norepinephrine reuptake inhibitors. Finally, we can look at mixed action agonists. These ones, they target all the receptors, that is both alpha 1, alpha 2, beta 1, and beta 2. And they are majorly used, that is ephedrine and pseudoephedrine. These ones are being used in local anesthetic of the mucous membranes. Ephedrine and pseudoephedrine are used as local anesthetics in mucous membranes like nasal, oral, and larynx. So whenever there is anything we want to block in these places, they are being used as local anesthetics, and at the same time they are being used as decongestant, nasal decongestants. But they are of limited use due to their widespread action, that is ephedrine and pseudoephedrine. So this is what we can discuss in this session. And never forget, whenever we saw nasal decongestant, it means they are targeting beta 2 within the bronchus, meaning it can also be used in treatment of asthma, or what we call treatment of any bronchospasms which are being when there is a bronchoconstriction, we can use them by acting as bronchodilators. So this is what we can discuss in this session, whereby we have looked about catecholamines and non-catecholamines, which are direct acting by binding the electron receptors. We have seen their different uses, and we have seen indirect, those which either act by increasing release of norepinephrine, being used in the treatment of attention deficit hyperactivity, whereby you find people cannot concentrate on one thing. The babies, they are jumping, doing this, before they finish, they are doing this. We are using them to treat so that they can become attentive, they can become awake. And even those ones who does a lot, like in narcolepsy during the day, we can always use them. And even in treatment of hypertension, then we have seen also these are the ones which inhibit reuptake, whereby we can use them in the treatment of depression and anxiety. Then these ones which have mixed actions, being as local anesthetics in mucous membranes, nasal decongestants, and treatment of bronchospasms. Thank you so much for learning until the end. We are always privileged to have you, and may God bless you.